Hello, RN to BSN students. I want to thank you for taking time out of your busy schedule to participate in this polypharmacy learning module and why it matters. This learning module is about polypharmacy in the elderly and tools to help manage that and nursing interventions in helping elderly patients manage polypharmacy. So what is polypharmacy? Polypharmacy is generally defined as an elderly patient that is taking 5 or more medications, or it can also mean a patient that is on medications that are inappropriate for them. So some background information on this. We're going to talk about the elderly population in the world today. The National Institute on Aging reports that the older adults aged 65 and older make up about 8.5% of the world's population currently, around 617 million. And this population is projected to grow to about 17% of the world's population by the year 2050, or 1.6 billion people. So that's about a 50% increase between now and the year 2050. Polypharmacy is very significant in the elderly population. That's because the elderly usually are on many medications because they have multiple comorbidities. So they usually go to several different doctors who put them on different medications for their different medical problems, and that leads to a problem for the elderly population. Being on too many medications increases the risk for drug interactions and adverse drug effects. And it's also a problem with patient adherence. Patients have a hard time being on that many medicines and being able to keep track of that. It gets a little confusing. And polypharmacy is also considered when a patient is on inappropriate medications. So 30% of the older adults in the United States take 5 or more drugs simultaneously. So we are going to talk about the different types of polypharmacy. We've already covered what polypharmacy is, but there are 2 types of polypharmacy. The inappropriate polypharmacy is when patients are taking medicines that are not appropriate for them. They may not be clinically indicated, or the risks outweigh the benefits. And then we also have appropriate polypharmacy, and that is when a patient is on multiple medications, but that is needed for their medical conditions, and that's very common in like diabetes or high blood pressure. It is appropriate so long as the prescribing is evidence-based and represents patients' medical conditions and considers potential drug interactions. Why is polypharmacy important in the elderly population? Polypharmacy is important in the elderly because of many physiological changes in their body that affects how their body processes medications and how their body responds to medications. And this has to do with the pharmacokinetics and pharmacodynamics, which we will discuss next. Adverse drug reactions and drug interactions also occur more frequently in the elderly, about 3 to 7 times more frequently than middle-aged or younger adults. So adverse drug reactions includes side effects. Also, drug toxicity may develop in the older adult for drug doses that are therapeutic for younger adults because of the changes in their metabolism and excretion of drugs. Let's examine what pharmacokinetics means. This term covers the areas in the body of absorption, distribution, metabolism, excretion, clearance, and elimination. So the elderly person has a change in pharmacokinetics, which causes them to be more susceptible to drugs than younger people. Their body does not metabolize the drugs as effectively due to the decrease in their liver function. And also with excretion via the kidneys and clearance and elimination, their kidneys are not working as well as they used to, and therefore their body is not clearing the drugs as quickly as it used to. So these are very important considerations for an elderly client, because usually their medication dosages have to be decreased based on these physiological changes. Now let's discover what pharmacodynamics means. And this is defined as what the drug does to the body, or the response of the body to the drug. And pharmacodynamics is affected by different things, including receptor binding, post-receptor effects, and chemical interactions. In older adults, the effects of similar drug concentrations at the site of action or sensitivity will be usually greater or lesser than those in younger people. As you can imagine, there are many problems that are associated with polypharmacy. And some of the common ones are adverse drug reactions, and this represents a serious and growing public health problem in the elderly population. Adverse drug reactions are unexpected, unintended, and undesired or excessive responses to a drug. Adverse drug reactions are usually caused by polypharmacy and inappropriate prescribing. So inappropriate prescribing, or IP, encompasses potentially inappropriate medications, which are called PIMs, and potentially prescribing omissions, or PPOs. And this, we will discover these a little bit later in this PowerPoint. Drug interactions are also a complication of polypharmacy. And this covers the drugs interacting with other drugs, or drugs interacting with foods. Drug interactions lead to adverse drug reactions or side effects. And drug interactions may alter the pharmacokinetics in the elderly person. And the intended effects of the medicines may either be increased or decreased as a result of the interaction. So most of us are familiar with a patient being on Coumadin and then consuming too much vitamin K, which will basically inactivate the Coumadin and it won't be effective in preventing blood clots. And grapefruit juice and statin drugs, the chemical that's in the grapefruit juice can basically inactivate the statin drugs or certain blood pressure medications. Patients not adhering to their medication regimen as prescribed can be a big problem in the elderly. And usually that is due to the cost of medications. Many elderly people are on fixed and limited incomes, and therefore they cannot afford to take their medications and eat sometimes. So maybe they have to choose between foods and drugs. So maybe perhaps an elderly client will only take half of their medicines in order to be able to afford those medications. And this is considered underuse of medications. And then overuse is a possibility, and that would be taking too much of a medication, perhaps because they're confused about how much they're supposed to take of that medication. And then misuse is not taking medicines as prescribed, and some elderly clients don't take the medicines as prescribed, either because they're just non-compliant or maybe due to financial factors. And then sometimes the medication regimen is complex and confusing. So maybe they're taking they're taking several medicines once a day, or they may be taking other medications 2 or 3 times a day. And sometimes the elderly patients misunderstand the instructions that are given to them by their prescribers. So there's a lot of factors that go into medication non-adherence in the elderly. A tool that can be used by prescribers to help with polypharmacy is called deprescribing. And deprescribing is when a doctor sits down and looks at the patient's medications to see if there's any medicines that can be discontinued, or perhaps the dosage cut back, and they just want to look over all their medicines to see what changes need to be made to benefit the patient. And optimizing medication through targeted deprescribing is an essential component of managing chronic conditions, avoiding adverse effects, and improving outcomes in patients. The goal of deprescribing is to reduce the medication burden and to maintain or improve the quality of life for elderly patients. And we will talk about some tools that can be used in the deprescribing process here in just a few slides. One of the tools that can be used by prescribers in managing polypharmacy in the elderly is the Beers criteria. This was developed in 1991 by Dr. Mark Beers. This tool helps prescribers to recognize potentially inappropriate medications. It is a very large list of medicines in different categories that are potentially inappropriate for elderly patients. It is used in any healthcare setting except for hospice and palliative care. There are a whole lot of drugs that are actually included in the Beers criteria for potentially inappropriate medications in the elderly. So there's way too many to be listed in this PowerPoint, but to give you some of the categories in the Beers criteria, the Beers criteria is for potentially inappropriate medication use in older adults. Drugs to be avoided in older adults due to drug disease or drug syndrome interactions that may exacerbate a disease or a syndrome. Potentially inappropriate medications to be used with caution in older adults. And potentially clinically important non-anti-infective drug and drug interactions that should be avoided in the older adults. And then non-anti-infective drugs that should be avoided or reduced dosages based on an elderly person's kidney function. The start and stop criteria are another tool that can be used to manage polypharmacy in the elderly. These tools were developed in Europe and they were first published in 2008. It was updated to a version 2 in 2015. And the START stands for the screening tool to alert doctors to right treatment. This tool helps alert prescribers to potential prescribing omissions, which means drugs that they could be prescribing to their patients based on their medical conditions that may be of benefit to the elderly person. And the STOP criteria stands for the screening tool of older persons' prescriptions. And the STOP criteria are used to discover potentially inappropriate medications, or PIMs. So STOP and the Beers criteria are very similar. So now let's talk about the role of the nurse in polypharmacy management. So nurses have an important role to play in polypharmacy management of their elderly patients, and that role includes the role of educating patients and families on the medication side effects and drug interactions. Nurses should also educate the patients about the potential benefits of deprescribing. Nurses need to be familiar with medications that are PIMs or potentially inappropriate, and so that suggestions for deprescribing can be made when appropriate. Nurses can also ask their patients about how they feel about all the medicines that they're taking and tell them about deprescribing and possibly discussing that with their physicians. Another important role a nurse plays in this process of deprescribing or polypharmacy management is that the nurses can inform the prescribers of observed side effects or drug interactions so that clinicians may remember to consider deprescribing. And it has been discovered that elderly patients are actually open to the thought of deprescribing or cutting back on their medications whenever it is suggested by either their doctor or their nurse. In conclusion, the elderly population is increasing and is expected to grow as we head on into the future. In the year 2050, the population of elderly is going to be in the billions. So polypharmacy is very important for healthcare providers to be aware of, and they need to know how to manage elderly patients that are experiencing polypharmacy, so we can help them to have an improved quality of life. Polypharmacy management tools include the Beers criteria and the start-stop criteria.